I'm calling this meeting of Coronavirus Special Committee meeting to order January 19th, 2021. Madam Clerk, please call the roll.
Alderwoman Davis.
Present.
Alderman Vaccaro.
Present.
Alderwoman Hubbard. Alderwoman Gracia.
Present.
Alderwoman Murphy.
Present.
Alderman Coder.
Here.
Alderman Muhammad. Alderman Oldenburg.
Here.
Alderwoman Boyd.
Here.
Alderwoman Middlebrook.
Present.
Alderwoman Clark Hubbard.
Here.
President Reed.
Here.
11 present, you have quorum.
All right. We're going to hold the excused alderman till the end, just to give everyone an opportunity to make it. So I will entertain a motion for approval of the minutes for January 7th, 2021.
I'll make a motion, we approve those minutes.
Moved by the alderman from the 23rd Ward, seconded by the alderman from 19th Ward. All in favor signify by saying aye.
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 Opposed? Motion carries. Board bills for review. The first board bill number one, Board Bill 239, item number one, excuse me, Board Bill 239. Either Alderwoman Hubbard or Alderwoman Murphy. Alderwoman Murphy, you recognize.
Yeah, I would like to introduce Board Bill 239. It's an $80 million relief fund bill. It provides $9 million in funds for rental and mortgage assistance, $4 million for assistance in water and sewer bill payments. It also provides about $75 million to cover COVID-related expenses, and that would include vaccine distribution, contact tracing, high risk in underserved areas, mental health services, funding for child care centers. There's also in the drive, I cannot bring mine up right now, there is a letter of support from the Realtors Association for this bill also. And I'm going to turn it over to Steve Conway in the mayor's office to be more specific for it.
All right, thank you. Mr. Conway, you're recognized.
Good morning, Mr. President and members of the committee. Board Bill 239 is in response to HR 133 that passed in Washington, D.C. late December and signed by, I guess, very soon to be gone, President Trump on December 26th. We've expedited the process because there are a number of things that were done in what would normally be the omnibus bill that passes in DC, but also they had added a number of COVID relief items. Most importantly is they've added rental assistance and utility assistance going forward. They've made available about 14 or 15 different healthcare grants to supplement our efforts. And as to the healthcare grants, Dr. Eccles is on, but as to the healthcare grants, each of them have to be applied for. Some will come through the state, some will come from the CDC, some will come through the other organizations that have been funded. So he needs the flexibility to apply to assist our residents throughout. One unique aspect of this bill was a special provision for water and sewer utility bills. That potential $4 million will be allocated through the states, and then the states will distribute it out to the regional governments. The nice thing is, as to that, it has specific income guidelines in need, so the state will have to give it to the areas of greatest needs. We project that amount to be about $4 million. The other thing, as to the rental assistance, we've done it differently this time. They gave cities and counties over 200,000 in population the opportunity to apply for the funds directly from the Treasury Department. And we've applied for that on the very first day. It closed last week, but the very first day available, we applied to get ours directly. So we do not have to wait for the state of Missouri. And the significance here is we have to act now. I realize that the Board of Aldermen is coming close to a recess. We want to get these funds put in place. I know that Valerie over at Department of Human Services has been working very diligently to come up with a new program for the rental assistance. We project that we will have $9 million for additional rental assistance. I'm open to questions.
Right. Ms. Conway, for the eviction moratoriums, it's my understanding that they are supposed to end at the end of January. Is the eviction moratorium, is that still a priority? And can you talk a little more about that?
Well, unfortunately, this bill, you're correct, only extends the eviction moratorium to the end of January. Our local circuit presiding judge Stelzer and Burleson have extended our local order to the end of January. But for the processing purposes, the number one priority are people who have eviction actions filed against them. I will tell you that I know that President Biden is working up a draft of a new bill. I believe that provision in the new bill that hasn't even been introduced yet will put the eviction moratorium off till September of 2021. But yes, Mr. President, you're right. The number one priority is anybody in the eviction process, because they can't pay rent, are being processed first.
All right, thank you. Now we'll go around. Alderwoman from the 19th, Alderwoman Davis, any questions?
I do have one question. What kind of relationship, I saw the letter of support from the Realtors Association, but we also need to have a way to make landlords aware and somehow assist them in getting their renters to apply for the funds. Because if they don't apply, everybody stays in that bad situation. So do we have anything actually get the information out?
Okay, Valerie Russell is working on that now, but the unique thing is in this new bill, the landlords can apply for the rental assistance directly. The little quirk in the matter is that the tenant will have to co-sign the application.
Right.
But the director of Department of Human Services, Valerie Russell, has already put together a fact sheet and a process for our potential providers relating the new applications under the new provisions.
Okay. Is there any way for us through our records with the assessor's office to identify multifamily units and maybe send a message to them?
The assessor does have that information as to the twos and the four, well, to any combination thereof, I can tell you that. Whether or not we send them a message, I don't know how complex that would be. I'll make a note of it. The realtors obviously are on board. We do have a number of organizations that work with landlords.
Right.
Valerie will give this some thought, and I will give this some thought on how to make sure that it becomes greater knowledge out there that the landlords can make the applications for their tenants.
Thank you very much. That was my main concern.
Okay, thank you. Alderman Vaquero.
Yes, yeah, I'm sorry. I really have no questions. I think it's a good idea, and I'm glad we're getting it in this before the session.
All right, thank you. Alderwoman Tammika Hubbard. Alderwoman Ingracia.
Thank you, Mr. President. Hi, Steve. Looks like you're reporting to us from an undisclosed location this morning.
Yes, the back porch.
I just have a couple quick questions. Can you speak to us a bit about how this money will be allocated? I know we had touched base before, and I think the city had some more positive experiences with some of the organizations that were originally allocated rental funds than they did with others. So just curious how we're going to get this into the hands of the providers who can then turn it over to the folks who need it the most.
Okay, well, Valerie Russell has already reached out to a number of the providers that did the first round. And she has cultivated a good relationship with them and knows who can process the most applications the most efficiently. And so we will still have a large number of applicants being processed. We might not have all of the same 14 providers, but I know that we'll at least have more than 10 providers.
Okay, and are you able to extend those contracts and not have to issue an RFP?
We are working on the extending of the contracts. And it's a little convoluted, but Valerie has managed to work through it. We have some people still with CARES Act money because we had 90 days to actually ship it out the door. And so we're continuing to process until we receive the new funds. She is looking at extending everybody's contracts. And Valerie, I know you're on here, so correct me if I'm wrong, for 6 months.
That's
Okay.
correct.
Thank you so much. And last question is, does the city already have, and if not, would we be able to include a provision that if landlords receive money in order to help cover rent, that they would agree to not file an eviction while the moratorium is still in place?
That's a provision in the new law for HR 133 that if a landlord accepts the funds, they have to stay in eviction order for at least 120 days. And that the provisions also allow for providers not just to pay arrears, but additional months forward if the funds are available. What Steve did not mention, and that I'll just share with the group, is that those providers who are also working with the legal assistance activities and eviction mediation, we do intend to continue those contracts as well, so that tenants do have an opportunity to have someone help represent them or advocate on their behalf.
Okay, so then some of that 9 million will be able to go towards mediation support?
We're using the CARES Act funds for those until we get more clarification about limitations and language within this particular funding source.
Thanks so much. I don't have any other questions.
All right, Alderman Coulter.
Thank you, Mr. President. Steve or Valerie, I know you mentioned in the first round there were 14 rental assistance providers. I'm on the city's website. Can we get that list, or is it available somewhere, just who they are? I'm more just for my own curiosity.
I can certainly release that. Our concern in not publicly releasing it was because we had a number of providers who were starting to get calls directly, tying up their phone lines when we were encouraging people to use the online application process. But we can let you know who those were.
Understood. I get that. Well, I mean, obviously, I would continue to steer constituents to the public, through our portal. But I'm just curious to see who these providers are, especially since we've got contracts with them and are giving them. I'm assuming there's some, they can cover administrative costs through some of this money, right?
That's
Yes.
correct. They are
Okay,
provided
yeah.
with administrative.
So I don't want all the contracts. I just like a list. Steve, or I think this is probably a Steve question, on the $4 million for water and wastewater arrearages. can you walk me through the mechanics of that? I mean, obviously our water department is a city enterprise. So does that money flow to the department? And then, I mean, I'm assuming we're not going to give it to the consumer to then give back to the city. How will that work? And can you explain similarly for is the other part for MSD? And do we know kind of breakdown of what of the 4 million is going to go for water versus wastewater bills?
So they are still developing based on the income guidelines on how that nationally, it's about $650 million. It'll be distributed to the states and then be redistributed. But two things I can tell you. A, it's not been distributed to the state. We don't have the process from the state down yet. But the water departments and the MSD should have the ability to make the application on behalf of the residents, the way I read the law as it is now. So we have to, on that, we have to wait for the state to act. And I would imagine that the General Assembly will pick this up pretty quickly. And we hope to see something out of Jeff City in less than 3 or 4 weeks.
Okay, thanks, Steve.
We'll
And then
keep you posted as to the details. We do have a lot of people whose bills are not being paid.
Great. Last question on well, I guess I have 2 more. On the 9.4 million, I mean, based on sort of our first round of rental assistance, do we know what percentage of sort of these funds goes towards, administrative costs versus actual assistance, to renters or homeowners?
Right. And that's first, Valerie, go ahead.
I was going to say the omnibus bill only allows 10% to go toward administrative costs.
Thanks, Valerie. And I guess my last question, maybe more towards President Reed. I'm sorry, I don't have the agenda in front of me, but as part of this meeting, I mean, it would be to the extent Mr. Conway can give us sort of an update on where we are with vaccinations and working with the state on that. I think that would be very helpful. I'm sure many of my colleagues were getting a lot of questions about that, and there's a lot of confusion around that process.
Well, Dr. Eccles is on this call as a participant, I believe.
Yes, Mr. Conway, we'll take that up under other items for discussion.
Thank you, Mr. President. Nothing further from me.
All right, thank you, Alderman. Alderman Muhammad. Alderman Muhammad. Alderman Oldenburg.
A lot of my questions were asked and answered, so thank you, Mr. Chairman. No questions.
All right, thank you. Alderwoman Pam Boyd.
A lot of my questions were asked and answered. Thank you.
You're welcome. Alderwoman Middlebrook.
No questions, thank you.
Okay. Alderwoman Clark Hubbard.
No questions, thank you.
All right. Any further questions? Any further questions? Mr. Conway, I know you had some other speakers on the list. Is there any other relevant information you'd like to give us before we go to the vote?
The only other thing I would ask you, Mr. President, is please be prepared to bring the alderman back into special session when President Biden gets his new bill passed. This will be the Nancy Pelosi version. We believe they have it. There's already drafts circulating of what's in it. That could be passed as early as the 3rd week of February. And we would want your assistance in helping us make those funds available to those that are in need in our community.
We absolutely will, especially with it being the Nancy Pelosi version. I would imagine that would be just a little bit of help to us in the city. So please keep my office informed, as things progress. Give us as much notice as possible, and we'll make sure all the notice gets out to the members of the board, and we will come back in session to handle that.
Thank you.
All right, thank you. Alderwoman Murphy, you're recognized to close on the Board Bill 239.
Yes, sir. Thank you. And members of the committee, I ask that we pass Board Bill 239 out of committee with a do pass recommendation.
It's been moved by Alderwoman from the 13th that we pass
Second.
Board Bill 239 out with a do pass recommendation, seconded by Alderwoman Pam Boyd. Any discussion? Madam Clerk, please call the roll.
Alderwoman Davis,
Aye.
Alderman Vaccaro,
Aye.
Alderwoman Tammika Hubbard, Alderwoman Gracia,
Aye.
Alderwoman Murphy,
Aye.
Alderman Coder,
Aye.
Alderman Muhammad, Alderman Oldenburg,
Aye.
Alderwoman Boyd,
Aye.
Alderwoman Middlebrook,
Aye.
Alderwoman Clark Hubbard,
Aye.
President Reed,
Aye.
10 aye votes.
By your vote, staying the motion, Alderman from 13th, and pass Board Bill 239 out with a do pass recommendation. We have no resolutions for review. Other items for discussion. Alderman from the 7th Ward. Would you like
Yeah,
to pose your question now?
Sure. Thank you, Mr. President, members of the board. I mean, I think while we're having this committee meeting and we've got Dr. Eccles present for a little bit, you know, I know he does weekly calls with the mayor, but for all those that are tuning in, I think it'd be helpful if he could sort of give us a rundown on where we are with vaccinations and what that process looks like. I know there's a lot of confusion. I'm getting a lot of emails and calls about it. There's certainly some confusion amongst the public. I know we had a website go live Friday. So if we've got a few minutes, I think it would be great if he could speak to where we are and as a city in terms of the vaccination process.
Dr. Eccles, you're recognized.
Good morning, members of the board and the Coronavirus Special Committee. Alderman Coulter, thank you for your question. So what the city is right now is, you know, we've completed the application process. Our application was approved. We ordered a vaccine, but we're just waiting on the state to issue it for the city. To date, all of the vaccine that has been received, at least prior to today, all of the vaccine that was received in the city of St. Louis went to the hospital systems. And that was important really for them to make sure frontline workers could receive the vaccine. In addition to the health department submitting an application, the federally qualified health centers, at least 3 of them submitted applications and were approved, but I think one of those agencies just received vaccine today. So there's just been a delay in the city, not just for the health department, but for just overall outside of the hospital system. This is an unprecedented challenge. We know that there's a great need for the vaccine to get into our communities, but a lot of things are out of our control. So we are having ongoing communication with the state. But again, as I said, a lot of things are out of our control. We are advocating diligently to receive the vaccine as quickly as possible. But we also have to be mindful of some of the challenges, particularly with the 2 vaccine products that are currently approved under emergency use authorization by the FDA. One being Pfizer, which requires ultra cold storage. So after you receive the vaccine, you have to use it within 10 days. And after it's reconstituted, you have to use it within 6 hours or it goes bad. And so, the health department's emergency preparedness response program has been working diligently. We've been working with several organizations across the city of St. Louis to get personnel rosters, so we'll know exactly who within particular organizations want to receive the vaccine, so we can properly allocate vaccines for vaccination clinics for those institutions. And that will do a couple of things for us. One, it allows us to properly document vaccine usage, but it also allows us to minimize the potential for wasting vaccine during those events. Again, with these cold chain restrictions for these vaccines, it's really important that we do a lot of planning on the front end to prevent any the wasting of resources in the city of St. Louis. And so although we haven't received vaccine yet, we are continuing to engage our partners across the city. We're also having ongoing discussions with other organizations in the St. Louis regions who have received vaccine to learn to receive information on some of their lessons learned, so we don't have to have some of those same pitfalls. So again, it's an unprecedented situation, but we are doing our very best to get as much vaccine in the city of St. Louis as fast as we can. We do know that St. Louis County received vaccine. They received 975 doses. However, they also had over 170,000 individuals registered through their platform, and so the supply of vaccine that's being issued to local health departments has not been sufficient to meet the need. The city of St. Louis isn't the only jurisdiction in this state of Missouri that has not received vaccine. So there are several jurisdictions outside of the St. Louis region that have yet to receive vaccine. And so we aren't in this isn't a unique situation for the city of St. Louis. I do understand that there's when neighboring jurisdictions receive vaccine, that can create a perception, but we aren't the only jurisdiction in the state of Missouri that has not received vaccine yet. But again, we are working diligently and advocating to receive as much vaccine as possible through the state of from the state of Missouri. But we also want to make sure that we properly manage those critical resources when they're received.
Thank you, Doc.
All right, we'll go around for any additional questions. Alderwoman Davis.
Thank you, Mr. President. Dr. Eccles, one of the things that was of concern to me, how we need to really impress upon the public not to register more than once, because it really complicates this process. And I wondered how the task force will be trying to remedy that problem.
Alderwoman Davis, that's a great question. So there isn't a universal platform where individuals can register, right? And so that creates additional issues. But what we are doing is encouraging individuals, if they have an opportunity to get the vaccine, get it at the earliest opportunity that's presented to them. And that can, although it's difficult for us to prevent individuals from registering more than once, particularly if they're registering on different platforms for different jurisdictions, what we can do is sort through the information that we have on our, that we're collecting from our partners, individuals that are registering using the platform that was published on the city side last week. And so we can go through that information. Then we also have follow-up questions when individuals do present to receive the vaccine, so we can sort out some of those things hopefully before they show up to get the vaccine, or before they actually when they come to a particular event.
Okay. I guess I'm not sure if I'm not an IT person, but I do know that when I worked for the Department of Health a number of years ago, and we're more advanced now, we had the opportunity to interface with all the health departments because I carried a special needs caseload. And maybe on the state level, everybody needs to coordinate and find a way that when that person's name is entered, it can be removed from all other lists automatically.
Yeah, again, that would be ideal, but even with different jurisdictions having different platforms, those platforms may not communicate. And I know the state was working on a registration system, but that's something that's still in development, and I'm not sure and they haven't provided information on what that rollout looks like. And so still lots of unanswered questions at this point, but we are again doing our very best to advocate for vaccine resources and other public health resources for the city of St. Louis. And we're hoping that, within the next few business days that some of those will be provided to the city of St. Louis.
Thank you very much. That's all I had.
Alderman Vaquero. Alderman Vaquero. We'll come back.
I'm fine.
All right. Alderwoman Tammika Hubbard. Alderwoman Ingracia.
No questions. Thank you, Mr. President. Appreciate the update.
All right. Alderman Coulter.
Nothing further.
Nothing further. Alderman Muhammad. Alderman Oldenburg.
No questions.
Alderwoman Pam Boyd.
No questions, Mr. President. And thank you, Dr. Eccles.
My pleasure.
Alderwoman Middlebrook.
No questions. Thank you.
All right, Alderwoman Clark Hubbard.
Just one question. Thank you, Dr. Eccles. Thank you for all you're doing. You already know how I say that all the time, but I just got reached out. A couple of people reached out to me about, I guess they might be retired nurses or nurses actually still even working, to see if they could assist our health department in giving out vaccines. Do you all have any programs like that open, or anything that you can email information and I can forward it to them? Some nurses associations and things of that nature that want to help them if they can.
That's a great question. So one of the critical programs that the health department operates is the Medical Reserve Corps for the city of St. Louis, and this functions under the leadership of the Emergency Preparedness Program. And what the Medical Reserve Corps is a group of medical professionals, public health professionals who want to volunteer their time. So in the event that there's a public health emergency or special situation, we can pull on this group to provide that additional workforce support. And so that's one way that they can assist the health department in our efforts to distribute the COVID-19 vaccine in an efficient manner. And so the contact for that program is our emergency preparedness manager, Mr. Justin Hauser. And so I can send that information to you today.
Great, thank you. Thank you.
All right, thank you. Any further questions? Any further questions? Any further questions? Thank you so much, Dr. Eccles. I appreciate it and appreciate the update.
My pleasure. One quick thing, President Reed. So I know there's a lot of focus on the vaccine. And I think in some instances that's creating a false sense of security. And so what we're learning from a lot of the science that's out there is that even after individuals get vaccinated, they can still get infected with COVID-19. And so what we're seeing is carriers of SARS-CoV-2. They may have very minimal symptoms, but they can still infect others even after they get the vaccine. And so we still need individuals to follow those prevention measures that we talk about day in and day out. So wearing a face covering, social distancing, staying home if you're ill, implementing good hygiene practices, because those are really the key to slowing the spread of COVID-19. The vaccine will help provide some immune protection, but to stop and slow the spread of COVID-19, those other measures have to be implemented on a regular basis. And so I'm hoping that the Board of Aldermen and also the Coronavirus Special Committee will help the City of St. Louis Department of Health echo that message across all of our, across the jurisdiction and across the region, because we don't want people to feel like the vaccine is a panacea. It's not a cure-all. They never have been, with the exception of a few cases. But in this event, we're still learning a lot about the type of immune protection that the vaccines will provide. We're also learning a lot about how it impacts the health of different individuals. And so we really need people to focus on not only getting the vaccine, but also continuing to implement those key preventive measures.
All right, Alderwoman Murphy, sorry I missed you.
Quick question for Dr. Eccles. That information about the medical reserve people, is that going to be placed on the city website so we could direct constituents? I have numerous constituents that are retired nurses and whatnot. I could direct them to one specific spot.
Yes, we can do that.
I think that would be, I like picking one spot rather than going from this person to that person. Thank you so much.
Thank you. And thanks again, Dr. Eccles. Appreciate the update. And thanks for all the work you're doing to keep our constituency and people safe, and also coordinating across the region. That's a really important thing right now, because we're all, relying on the same health system anywhere in the region, right? So we cannot overburden the health system because of lack of cooperation. So I appreciate and thank you for that. All right. So, Madam Clerk, do you have a list of the aldermen who are absent today? I have Alderwoman Tammika Hubbard and Alderman John Collins Muhammad.
That is correct.
All right. So I'll entertain a motion to excuse the absence of Alderwoman Tammika Hubbard and also Alderman John Collins Muhammad. Moved by the Alderman from the 23rd, seconded by the Alderwoman from the 13th. Any further discussion? All in favor signify by saying aye.
Aye.
Opposed?
Aye.
Motion carries. I'll entertain a motion to adjourn.
So moved.
Moved by the
Second.
Alderman from the 19th, seconded by the Alderwoman from the 26th, and Alderman from the 7th. All in favor signify by saying aye.
Aye.
Opposed? We stand adjourned. Thank you all. Have a great day.